how the gut-brain axis relates to naturopathic medicine.
In 2025, like here we are, and everywhere you look, podcasts, YouTube videos, everyone's talking about microbiome. They're talking about parasites and bacteria, and
And I think it highlights the importance of gut health in the treatment of neurodegenerative and mood disorders.
you know what? Like leaky gut is a thing, and
Yeah.
mood is connected to it, and it's really exciting. We're excited, and we go, look at this.
Okay, today I wanted to talk about the gut-brain axis with Shannon Burford. And Shannon, today I think it'd be good to go into how the gut-brain axis relates to naturopathic medicine,
Yes.
and to not necessarily analyze a study, but the Barbosa 2020 study that we've taken a look at. I think it's a good study to anchor us, and it really shows it speaks a lot about the pathophysiology, and talks a lot about diets, dietary intervention for neurodegenerative diseases and so forth. And I think it highlights the importance of gut health in the treatment of neurodegenerative and mood disorders like depression,
Yes,
anxiety, etc. So
Yeah,
what are your thoughts on that?
yeah, 2025, like here we are, and everywhere you look, podcasts, YouTube videos, everyone's talking about microbiome. They're talking about parasites and bacteria and probiotics and everything like that. And we've known about it over 20 years, and naturopaths have been harping on about how gut is the core and it's a second brain and all of that. But here it is, and science is 20 years plus later going, you know what? Like leaky gut is a thing, and mood is connected to it. And it's really exciting. We're excited, and we go, look at this. Yes, it's explaining it.
Yeah.
And it's becoming definitely more mainstream.
And I think it was like, it just feels like yesterday that everyone was saying there's no such thing as leaky gut. And
Yes.
then the term intestinal hyperpermeability, which is what we learnt it as, came into the literature, I guess.
Yeah.
And
Yeah, just a silly term, but
yeah, and and everyone, we all sort of joke, well, that's what leaky gut is, and now I'm seeing actually leaky gut used as a term in the literature itself. I think this
yeah,
study even
it's a
uses
it's a brilliant
that term.
term. Like it explains it so well, and I just
That's right.
visualize that leaky leaky bucket and all that waste coming into the body. And think about, so this study talks about neurotransmitters and mood disorders, but think of all of that waste coming through: inflammation, autoimmunity, pretty much anything really has a component of intestinal permeability and issues. Yeah, it's exciting.
Yeah,
So
and it's implemented in so many conditions, isn't it? And you know, is it something you commonly treat and see in practice?
yeah, we both know the answer to that. Of course, and same with you, Brad.
Yeah.
Yeah, even if someone is coming in for inflammation in their joints, or they've got arthritis, or they've got sleep issues or whatever, you know that if you just ask them a question about their stools, you know something's going to come up. It's going to be bloating, or you agree, right, Brad?
Yeah, definitely, definitely.
Yeah.
Um,
Yeah, like let's think about the last week. Pick a random patient you've seen, Brad. I
yeah,
bet you they had gut issues.
the three of them, I think. So, and look, I think we're well positioned in our field, not just because we're all over the whole microbiome analysis and functional testing, but our rich history in treating the gut. And, our herbs are brilliant at stimulating digestive secretions and improving the epithelial tissue, the lining of the gut, and the mucosa of the gut, and overall function, liver function, and blood sugar balance and pancreas function. So we're really well positioned to treat gut disorders, and quite often where people come to us and they've tried every other avenue. And then,
unfortunately,
they get to us, and we get on top of the issues for them. And
so this study, it highlights that point. Okay, it's a second brain. It's connected to mood disorders, but just as you say, we've been doing that a long time. So let's share with the viewers about those things they can take away that can really help them with the gut and with the mood and with all those health issues with the gut, because clearly, like you said, we've got that experience and we've built that naturopathic philosophy of explaining what can help. So let's start to dive in a little bit about some things that are really important for that viewer to get help with the gut.
Yeah, well, we've talked about intestinal permeability, and I think what we need to sort of address is dysbiosis, I think, which is an imbalance in bacteria. Now, what we see a lot of at the moment is SIBO, so small intestinal bacterial overgrowth. Now, I don't know what your take on SIBO is, but for me, it sort of comes under the umbrella term dysbiosis. And even there's I don't know if you'd call it a debate, but there's certainly been recent research to question whether it's small intestinal bacterial overgrowth or just the incorrect bacteria in incorrect balance. So, is it normal amounts of bacteria in the small intestines that are just not in balance, or is it coming from the large intestine into the small intestine? And so there's a few nuances there, and certainly we have seen a lot of concerns treating something like SIBO in regards to poor testing with the breath testing and so forth. A lot of false positives, I believe. And look, and again, when we start looking at something, isolating the small intestines in this case, we're going away from holistic treatment too. We're not treating the person.
Yes, definitely.
And this is probably interesting enough. The study we've referred to, they mention at the end of it how not difficult, but they were saying that more research needs to be done to highlight areas of therapeutics where addressing it with probiotics, etc., and so forth. So I think that's correct. You always want to get more research, but usually when they're speaking in those terms, they're looking at conventional medicine and
quick
specific targets with pharmaceuticals. However, what we've been doing, coming from a traditional background and using traditional Western herbalism, for example, and traditional diets, which really a lot of what we, I won't say preach is not the word, because you can have varied diets, like getting more to ketogenic and so forth, but like the anti-inflammatory diets that we often recommend are really highlighted in the literature with the Mediterranean style diets, which has the most literature behind it as an effective diet. Rich in omega-3s and monounsaturated oils, as well as fruit and veg. So I think we are treating people holistically, and while we might do a lot of microbiome analysis, and if someone comes to me with they've tested positive with SIBO through certain tests and so forth, I'll acknowledge it, but I'm still looking at them as a whole and considering things outside of just outside the bloating or the small intestinal bacterial overgrowth. I'm considering blood sugar and so forth, and that might lead me to recommend herbs that will address those factors as well as the potential pathogens or whatever's causing the dysbiosis. So I think I've drifted off what you're originally talking about, but I think basically my point being is, yes, we don't have exact research to point to specific therapeutics for, I think they're referring in the study, they're referring to more neurological diseases like Alzheimer's and the likes, and depression and anxiety as well.
Yes.
So yes, you can't say that this probiotic's going to treat depression or this,
Yeah.
but that's not how we operate
No.
anyway.
Yeah, they
We're treating
point
the
out
whole
like,
person, and we're utilizing many things to work on many aspects of that individual's health. So
yes. Yeah, they point out like it was great in the article. They point out like the severities and the more complex the health issue, like Parkinson's. They're talking about there are multiple things going on, which is true. But back to the beginning of what you were saying about the FODMAPs diet and SIBO. Yeah, like Sue Shepherd and that movement of the FODMAPs diet, it doesn't fix the problem. Like it helps the symptoms. And there's this giant movement with FODMAPs app and FODMAPs foods, and even supermarkets displaying the FODMAP symbol on it. But that's not a solution to fix the problem. It's certainly altering the foods that are going to cause less reaction. But commonly patients will come and they'll say, oh, I've done this and it's still going on. Maybe the severity has gone down. As long as I don't eat beans or I don't eat tomatoes, I'm okay. But we're thinking about how can we really fix this? And I think you touched on that point about it's complex and there's really herbs and stress, and each person is different. So for sure, there's a food component, and the FODMAPs diet may be helpful, but we've got to drill in to overcome the issue for good. We've got to drill into why. And you touched on opportunistic bacteria, and I think you said certain organisms there, and then you touched on herbs. And yeah, that's I guess I'd highlight that too, that it's really complex, and that's where personalized medicine and consulting, like who are you, and have you got stress, have you got children that you're feeding, you've got different dietary requirements, religion, age, hormones, and it goes on and on.
Mm-hmm.
So it's really important to look at you as the individual and make a plan just for you.
Yeah, and this is why functional markers are important when we look. We're not just looking at the landscape of the microbiota or the collective microbiome. We're looking at, you mentioned stress. Well, if cortisol's raised, it's often going to affect secretory IgA, the first line of defense in the gut health. So we're taking all those things into consideration. Not just the microbiome, but the actual function of the gut itself. And that can tell us many things, because we've got decades of traditional practice that has informed us how to go about treating individuals in a clinic setting and improving their overall health by improving gut health, digestion, etc. So yeah, look, exciting stuff. And look, I'm holding myself back because obviously this is such a big topic, and I'm sure we're going to revisit it more than several times again, because it's it's so relevant. And there has been a lot of, we've mentioned the Barbosa and Barbosa research paper there, and we'll link that in the description. But there's been a lot more research since then, 2020, that really highlights aspects of the gut-brain axis and its relevance to holistic treatment of individuals. And like, as we've discussed, we take it beyond that again and that's historically what naturopaths have done. I mean, the word holistic gets just thrown around by anybody now, whereas a GP or a dietitian or a lot of other health practitioners used to frown on that term, holistic. Oh, that's a naturopathic term. It's not a real thing. But everyone uses it now. And gut health, again, was something that was frowned upon, because naturopaths were always treat the gut, even before I did my undergrad, so we're going back a couple of decades now that, I remember people saying, oh, naturopath, they always treat the gut, and I worked on my liver for psoriasis, or they did, this. And now we're getting all this science behind it, and everyone's a gut health expert. But do they really know what that means? I mean, if you just stick with the clinical literature, like this Barbosa, you're looking at that and going, well, maybe there's not many treatment options. Whereas we look at neurological disorders and mood disorders and go, right, we know exactly what we can go in and do, and what we're looking for with those individuals. Are they digesting their foods properly? Are they breaking it down? A lot of little things we can do, and look at their stress and stress management, because everyone. Especially when I get my patients back on track. So when I get my patients back on track, they often tell me, "Oh, stress is not a thing," but stress is always a thing. And we've got to see if people are balancing their stress and if that's affecting sleep and other things too. Again, we could go into another half hour on herbs alone in treating both stress and gut stuff all in the same time as well. So
yeah, it's funny you say about the stress, because that's one that comes up. It just come up recently, but patients will say that. But I think about today's society, we all have a level of excessive stress, and that's considered the norm. And so patients will say, no, I don't have stress, but we all do. But it should be really down here. It should be zero stress.
That's right.
It should be a little bit of stress.
Yeah. I mean, a little bit, so always good, but we often take on way too much, and we don't recognize certain stresses too, whether it's excess blue light or other things that can really be playing a role in dysregulation. Okay, well, what do you think will be an interesting area of future research, or where do you think, based on this paper, like they talked about GABA, they talk about ketogenic diets and so forth, where do you think some exciting areas of future research will be?
It's a great question. I think quorum sensing will be a highlight.
Wow, what's that?
What's that? Well, I remember maybe about 15, 20 years ago, I'm sure you've heard of it, that study. I
have heard the term, but let's familiarize myself.
That yogurt where they split the yogurt tub into two, and then they got one half in one area, another half in another room or building, and then they killed that colony and the other was affected. So the quorum sensing is that all the organisms are connected. So our microbiome is also the same, where so if we're having probiotics.
Wow, I was kind of seeing where you'd go in relation to this paper, but you've kind of jumped into almost the quantum realm with that one. So that's fascinating. So you're thinking maybe small interventions having bigger impacts, so forth. So
mind body, like more of our mind power having an impact on our gut.
Well, that's it. We haven't talked about that. Like, we know that exercise improves microbiome health, and other things have a positive, being in outdoors and so forth. So yeah, for sure, doing anything that's lifestyle therapeutics, that we're seeing a big rise in the lifestyle medicine movement, and that's certainly, we're going to see research, I think, how lifestyle medicine affects the microbiome as well. So that's
the topic is just too huge and multifactorial. So as we've touched on it, there's just so much going on. Just pulling out the exercise you just mentioned then, yes, if you're doing something there, that's positively impacting your microbiome, just as is diet and mind and sleep and toxicity, and you know how it goes.
Yeah.
So if we, I guess, future research in all of those areas, and then the whole world will be healthier
Yeah.
with healthier microbiomes.
Well, we hope. Yeah. But yeah, look, exciting stuff. I'm certainly looking forward to seeing where the research goes. Hopefully we can see a few more advancements in herbal medicine research as well, because I think that's exciting, because we understand the huge impact that herbal medicine itself has on the microbiome, even how a healthy microbiome helps the utilization of our herbs a lot better too. So, all right, Shannon, I think we'll wrap it up there and invite listeners to comment on any of their experiences that they've had with gut health and what their thoughts might be. Where would they best find you?
Yeah, just curiamedicine.com is the best way. And just to add with your mention about comments, yeah, definitely we will reply. And we love discussions. We love to hear your thoughts, and we want to add to the conversation, and let's get it going. So definitely add your comments down below.